This way of strength training is better than any type of mobility program that you've ever tried. Hi, I'm Effer, founder of Resilient Training and Rehab, and I've helped thousands of coaches and practitioners get faster and more consistent results with their clients. Let's get into it. So traditionally, when it comes to mobility exercises, you often see exercises on the ground, and people spend 10, 20, even 30 minutes just doing a bunch of mobility exercise or this mobility flow. But if we can actually break it down, but if we take a step back, we can actually manipulate the variables in our strength training programming that is going to improve mobility while also getting people to train. So this is why in my programming, I take the assessment and start to create variations of exercises that you may commonly see in order to accomplish not only the mobility, but also to improve the fitness qualities. So we're going to address biomechanical movement and joint position, while also starting to incorporate some of the fitness-based variables that we commonly know and that we want to improve. So we're working with clients who want to improve strength, improve muscle mass, lose weight, or just go after aesthetic-based training. We can give them what they want and filter in what they need. We can just intelligently program exercises to check off as many boxes as possible so that we can have this full integrated program. So now I'm going to talk about 3 different exercises that we can manipulate in order to improve mobility while increasing strength, hypertrophy, and other fitness variables. So when thinking about rowing variations, I really like implementing cross-body rows. The reason for it is that I can focus on what's going on underneath the muscle, therefore improving mobility, but also think about targeting the muscle in a more effective way. And so when I'm thinking about this type of cross-body row, there's a couple things to keep in mind. First, what I like to do if we're using a machine, I like to turn my chest so only one side of my chest is on the pad. So if I'm gonna be rowing with my right arm, I only want my left chest on the pad, because what that's going to do is that's gonna turn my rib cage towards the right. Why that's important is if the rib cage turns to the right and then I reach towards the machine, now the scapula is going to be moving away from the spine. By increasing the distance from the spine and the scapula, I'm going to improve my ability to expand my upper rib cage, which is going to not only improve shoulder flexion and external rotation, but it's going to maximally lengthen the rhomboid, the middle trap, and all those other muscles that kind of cross in between that area. So when I'm going to set up, I'm going to start with my right leg forward, because I want to turn my body towards this right side. Because if I were to have my right leg back, my right leg would be extending, and that's going to turn my body towards the left. So right foot forward, pad, my left chest on the pad. I'm going to grab onto the handle, and I'm going to think about with this right leg, pushing myself back. So when I push myself back, that's going to further create this rotation towards the right side, and you're gonna feel a nice big stretch in the upper back. Take a big breath in. As I breathe out, I'm gonna further rotate. Again, just keeping this left chest on the pad. As I breathe in, I'm gonna come back to the starting position. I'm not gonna let the machine pull me with it. I'm gonna stay turned. So you can even look towards the right if that helps you. Really get that big stretch to the upper back. Pull. I'm not pulling past my rib cage. I'm gonna stop just where my rib cage ends, because if I go too far back, then I'm just gonna compress that area. I wanna keep that space open as I'm rowing. So again, I'm creating this type of rowing exercise while also improving shoulder mobility and neck mobility at the same time. And so again, I'm really letting the scapula rotate around my rib cage. I'm not letting my rib cage turn. And I'm just going to go back and forth, really emphasizing the length in the upper back. I really like using a safety bar squat because what it's going to do is it's going to force my elbows in front of me. It's going to be a little bit easier than a traditional front squat where people don't have that shoulder mobility or the wrist mobility to get into that position. So it's going to keep the elbows low, which again is great, kind of like with lower reaching exercises. Keeping the elbows low is going to open up that lower part of the rib cage, and it's going to translate into the lower part of the pelvis, because the rib cage and the pelvis are going to kind of mimic each other. So if I can open up that lower part of the pelvis, then that's going to allow me to get deeper ranges of hip flexion. To make it even better, I like to elevate the heels and get people to squat to a box first. By elevating the heels, I'm going to shift the center of gravity back opening up the hips even more, reducing tension around the hips, even around that rib cage, so that I can sit down a little bit lower. And by constraining them, by getting them onto a box, that is going to allow them to stop at a certain range of motion. Normally, if we don't give them the box, they just squat down towards nothing, then sometimes it becomes unstable. They feel like they don't know where to go. They start to compensate. And so giving that initial constraint of the box is going to be great. The other benefit of the box is that it locks them into a certain range of hip flexion. It's going to improve their hip internal rotation, which is going to be a key aspect for when they want to come up into the squat. I also like to add a little bit of the rolling back. As I'm sitting down, I'm going to roll back a little bit because that's going to further decompress the back of my hips. And again, relax those tissues so I can go into deeper ranges of hip flexion. So although I'm constraining them to 90 degrees of hip flexion, that doesn't mean that they're not going to improve past that. Just by decompressing the tissues and allowing the pelvic floor to relax as they hit the box, that is going to allow them to get deeper ranges of hip flexion so we can progress them to getting off of the box. If you like this approach to programming where it integrates not only mobility but also strength training, then check out our full body program. It incorporates exercises just like this based on the principles talked about in this video. Check out the link below. From a pressing standpoint, I really like using a decline bench. Because of the angle of the bench and because my hips are above my head, as we talked about before when it comes to inversion type activities, if my hips are above my head, then all of the air is going to go towards my upper body, which is going to expand the upper part of my rib cage, thereby improving shoulder flexion. The other thing that's great about this is because of the decline, when I'm pressing, it's going to be a little bit more of a lower range. So for people who are missing a lot of shoulder mobility, this is a great way to introduce some types of pressing variations without having them go into too deep a shoulder flexion, which they may not have. And so by getting them to reach in this lower range, I'm going to be opening up the lower part of the rib cage, which is important to starting to restore that shoulder flexion. So the position of the bench is going to improve shoulder flexion by just positioning my hips above my head. By doing these type of low reaching exercises, I'm going to further restore some range of motion without putting them into ranges they don't have access to, which is a key component that I like to think about when programming. I'm going to program based on where they have the range of motion accessible to them. If I go too far close to where they start to hit their end range of motion, they might compensate and they may restrict range of motion further. So this is a pressing variation I like to include early on in my programming, just because it's going to not only improve mobility in terms of shoulder flexion and hip mobility, but it's also going to get them to strengthen in a range they have access to. Now, although I started with a barbell, I like to usually start people in a decline alternating dumbbell press. And the reason for that is that the barbell is going to lock you into one plane of motion, whereas the dumbbell is going to give you a little bit more flexibility in terms of rotating. It's also going to, for some people, be maybe a little bit less scary just initially. And also, people could do it at home. Now, that's what's the great thing about doing dumbbell, again, is we drive that rotation instead of the barbell fixing you into place. Not saying the barbell is bad by any means. I actually start people with barbell sometimes. But if you want a low barrier entry weight in order to incorporate this movement, then doing dumbbell press is a great way in order to introduce it. By intelligently programming exercises in a way that accomplish many different aspects and improve many different qualities, we're able to not only get more integrated approach to programming, but we're also going to be able to give people what they need as well as what they want. If you like this type of perspective and you want more content like this, then don't forget to like, save, and subscribe, and I'll see you next time.